This presentation abstracting is sponsored by the National Cancer Registrars Association Education Foundation. During this presentation, we will define what a cancer registry abstract is, discuss what informational data is collected, identify the organizations that govern the rules of abstracting, and review how the data collected is used. A cancer registry abstract is a synopsis of an individual's cancer-related medical information from diagnosis through treatment and includes follow-up throughout a patient's lifetime. The information recorded in an abstract includes demographics such as address at time of diagnosis, gender, race, ethnicity, marital status, and insurance provider. The patient's history and physical includes the chief complaint and symptoms that brought the patient to the attention of the medical facility. A patient's diagnostic workup is an attempt to identify the nature, circumstances, and extent of a patient's symptoms. The workup can include, but is not limited to, imaging studies such as CT scans, ultrasounds, PET scans, and MRIs, diagnostic procedures such as colonoscopies and biopsies, lab tests such as CBCs, or tumor markers such as PSA for prostate cancer. These elements identify a patient's stage of disease and prognostic indicators at the time of diagnosis and assist the physician in formulating an appropriate course of treatment for the patient. Treatments vary depending on the type of cancer and its stage. Generally, the most common approaches use one or more of the following modalities: surgery, chemotherapy, radiation therapy, immunotherapy, and/or hormone therapy. Physicians continue to follow patients to determine their response to treatment by many of the same tests and examinations that were initially used to diagnose their cancer. Cancer registrars also collect information on a patient's health and well-being throughout their lifetime, including cancer reoccurrence or being diagnosed with another type of cancer. The cancer registrar reviews the patient's medical records and documents the diagnostic workup, extent of disease, and treatment of a patient by using codes and text. A complete record of a patient's treatment may mean collecting information from multiple sources outside the registrar's own facility, including physicians' offices, other hospitals, or radiation oncology treatment centers. Information sharing with other registrars is critical to comprehensive data collection and does not violate HIPAA, regulations governing confidentiality and privacy. To learn more on this subject, please view the confidentiality presentation. Cancer registrars must be able to determine what information is relevant to include in an abstract, and just as importantly, what information is irrelevant and should not be included in an abstract. Quality cancer registry data is the foundation of a cancer program, and it is imperative that the information documented is accurate and complete. Abstracting coding structure and requirements are established by the National Program of Cancer Registries, NPCR, and the North American Association of Central Cancer Registries, NACER. State central registries may add additional requirements specific to their state. Hospitals accredited by the American College of Surgeons Commission on Cancer follow additional rules and standards set by the Commission on Cancer. Cancer registry data has many uses, from a facility's planning for future growth to determining equipment needs or assessing the community's needs. Studies done using cancer registry data can determine how closely a facility follows national guidelines, the success of a new program, or how well quality of life issues are being addressed at the facility. The data can also provide a snapshot of the patient population, for example, where the patients come from or the type of insurance coverage they have. An abstract provides a synopsis of a patient's cancer experience from diagnosis through treatment and follow-up surveillance. The abstract must be timely, accurate, and complete. The data collected is standardized for uniformity through the United States and internationally. Multiple standard-setting organizations are responsible for the rules governing the collection of cancer registry data. Thank you. This presentation is brought to you by the National Cancer Registrars Association Education Foundation. For more information on the Education Foundation, go to www.ncraeducationfoundation.org. For more information on the cancer registry profession, go to the NCRA website at www.ncra-usa.org.